Thank you for coming out tonight. I hear it's a gorgeous night outside. I was afraid to go out because I might not come back. My name is Adele Hagney. I am the local history librarian for the St. Louis Public Library, and on behalf of the library, welcome to all of you. Just a couple of things. We have more things coming up in May that might be of interest to you. We've got a lot of good music coming up in May. We've got the Ariana String Quartet playing here next Thursday. We have the River Kittens Bluegrass Band the Thursday after that, which not only is a band with a great name, but they're really good. So please come back and hear them. We appreciate you coming out to the public library. I'm not going to introduce the program, though. I'm going to leave that to a professional. So John Posey can do that for us. Please welcome him.
Thanks, Adele. I'm John Posey. I'm Director of Research at the East-West Gateway Council of Governments. This is the third and final presentation in a series that we've done here at Central Library. And I just want to quickly do some thank yous. First of all, to our friends here at Central Library, Adele and Joe Schwartz up there in the booth, who did a brilliant job with the lights and sound. Thanks to you. Thanks also to our partners at Focus, including Yemi Akandabarch, who moderated one of our presentations earlier and will do so again tonight. And thanks as well to our other co-sponsors, the University of Missouri St. Louis Public Policy School of Public Policy Administration. And thanks as well to our distinguished panelists tonight. If you're not familiar with our organization, East-West Gateway, we are the Metropolitan Planning Organization for the St. Louis region. So under federal and state law, our responsibilities include doing the planning for federally funded transportation projects and approving these projects. One of these projects that I'd like to alert you to that's relevant to the topic tonight is a document that we produced called the Coordinated Human Services Transportation Plan. This is a document that we're responsible for updating every few years, and it guides the use of the federal funding stream that's devoted to transportation for elderly and the disabled. Rachel Pollack is in the back there. She has led the development of this document, and she'll be around to answer any questions that you might have about it. It is out, the draft plan is out now. The public comment period closes June 13th, is that right? Correct. June 13th. So I'd encourage you to go to our website and take a look and let us know what you think. Since 1992, East-West Gateway has published 7 editions of a document known as Where We Stand. The latest edition was produced last summer, and it shows how St. Louis ranks among the 50 largest metropolitan areas across a range of more than 200 variables. And in between the big publications that we put out every few years, we do a shorter series that we call Where We Stand Updates. And I'm going to turn it over now to Mary Rocchio. Mary has skillfully led the development of the Where We Stand family of publications, and she wrote the update on aging that she's going to present right now. So, Mary.
Thank you, John. Thank you all for coming tonight. Before I turn it over to Yemi and the panel to really discuss what's going on in the St. Louis region regarding the rapidly growing senior population, I just want to provide some data and background information. This is really what we hope to do with the Where We Stand document, is to try to provide context to important conversations that need to be happening in the St. Louis region. So I'm just going to touch on a few of the things that we included in the Where We Stand update. You can access the entire update as well as all of the Where We Stand publications on our website using this link here. And so I just kind of first want to start out with the basic facts. So what is the senior population in the St. Louis region? This is one of our Where We Stand tables here that shows ranks St. Louis among the peer metropolitan regions, so the 50 most populous regions in the country. And you see that St. Louis ranks 8th here. So we have a relatively large senior population in the St. Louis region. So we have 15% of our population is comprised of people that are 65 years and older. If we look at just the total population, we rank as 19th. So we do have a larger proportion than the United States as a whole in many of our peer regions. When we talk about this rapidly growing senior population, we project that over by 2045, our senior population will increase by 77%. Currently, we're at 374,000 seniors, and in 2045, about 1 in every 4 people will be over the age of 65. This is another way of looking at this. So this looks over a longer time period from 1990 to 2045. Looking at the gray boxes in between the bars there show the annual average increase in the senior population between the 2 time periods. So from 1990 to 2000, we saw a 1,400 person increase on average annually in the senior population. In the 2000s, that increased to 2,000 people. And then from 2010 to 2014, it really jumped to 10,000 people per year. And that's when the first of the baby boom generation turned 65. And then over the next 15-year period, we see the real big jump again, and we're going to really see that growth in that senior population. And then we start see it level off after all of the baby boom generation has turned 65 to about 3,000, an increase of 3,000 people each year. So this has a wide range of implications for us in our personal lives, as well as how we plan for this demographic shift, and really what policies and programs we need to put in place. So in the St. Louis region, this growth in the senior population isn't consistent across the entire region. This table shows the change in population for the St. Louis 8-county region from 2000 to 2010. And what we see here is that there is a larger increase in the population in the senior population in our outlying suburban and rural counties. So St. Charles, Franklin, Jefferson, and Monroe County have all seen over 23% growth over this time period. The city of St. Louis actually saw a decrease in the senior population over that decade. More recently, in the past few years, we have seen also an increase in the senior population in the city of St. Louis, but still not to the same extent as we're seeing in those outlying counties. People are staying in the workforce longer. So this where we stand table shows the percent of the 65 and older population that is employed in 2014. And St. Louis ranks towards the bottom, right below the United States, with about 16% of the senior population employed in 2014. The highest region here is Washington, D.C., which about a quarter of the senior population is employed in D.C. The chart here shows the change from 1990 to 2014. So we have seen an increase in the seniors that are employed over this time period. So it was 10% in 1990 and has increased to 16% in 2014. You might not be able to see these columns on the other side of the chart very well, but this is the unemployment rate for seniors. And it still remains under 1%, but we have seen an increase in the unemployment rate among seniors. And in 2014, there were 2,700 seniors that were looking for work but were unemployed. Aging in place is a main topic when we talk about this growing senior population, because the majority of older adults want to age in place. So they want to remain in their own home, they want to remain in their own community. So as local governments and as we policymakers and planners, we need to determine how can we make this happen? How can we facilitate for people to fulfill this aspiration to live in their own community and to do so safely and still be connected to the community around them. Perhaps central to this is housing. In order for people to remain in their own community, they need to be able to afford to remain in their own home. These two where we stand tables show the percent of seniors that are paying over 30% of their income on housing. The first one shows owner-occupied housing, and the second one shows renter-occupied housing. If you can see St. Louis highlighted in green, and we're at the bottom of both of these charts, which isn't surprising. We tend to have relatively affordable housing. But yet, if you look at these numbers, it's 25% of seniors who own their home are actually paying over 30% of their income on housing, and about 50% of seniors that rent their homes are paying this amount that's considered the threshold for what is to be affordable or a reasonable amount to be spending on your housing. Another important aspect of aging in place is transportation choice. So to be able to be connected to the community, be able to reach our services that we need, healthcare, and just continue to be involved in the community, we have to have the transportation options available to us. So this where stand chart shows the percent of seniors who do not have access to a vehicle, so do not own a vehicle. And St. Louis ranks about in the middle on this chart with about 1 in 8 senior households not having access to a vehicle. As John mentioned, at East West Gateway, we do the Coordinated Human Services Plan, where we work with service agencies and transportation agencies to identify the needs of seniors and persons with disabilities. In the development of the current draft plan, one of the things that was identified was a need for more transportation choices in those suburban and rural communities in our region. This is really important because, as I've just pointed out, those are where we're seeing our largest increase in our senior population. The last aspect that I wanted to touch on regarding aging in place is the health of seniors. So this chart shows the percent of seniors that have a disability. In the St. Louis region, about 1/3 of seniors, about 140,000, have at least one disability in 2014. The largest disability among people is a difficulty of climbing stairs or walking, and this affects about 1/4 of the senior population. And this population can be more likely to fall. And this is a huge problem among the senior population because falls can often lead to, they're a leading cause of injury deaths, and they also can lead to a loss of independence. So really lead to that inability to age in place and remain in one's own home. So that's just to touch on some of the data from our Where We Stand update. I'd like to invite Amy and our panelists up here now, and I'll let Amy introduce the panelists. But just to remind you, this is where you can find our Where We Stand updates and all the Where We Stand publications. Thank you.
Please join me in giving Mary a round of applause. My name is Dr. Amy Akande Barch. I'm the president of Focus St. Louis. For those of you who don't know Focus St. Louis, we are the region's premier civic leadership organization. We have been around, we have a very interesting history. Collectively, we've been around for 20 years, but we happen to have, I call it almost our stepchild, who's 40 years old in the form of one of our oldest programs. So we offer leadership training for a broad spectrum of individuals, from senior level executives to high school students. We have 8,500 alums, 70% of which still reside in the region, which is great. And I'm sure if I were to ask if there are any Focus alums in the room, you might at least have one. But I'm really excited to be here today to facilitate our panel on really aging in place. And our panelists tonight are, and you're not seated in order, so I'll just ask you by show of hand, just to raise your hand so folks know who you are. Lori Fiegel, who's the Director Strategy and Innovation from St. Louis County. Welcome, Lori. Sheila Holm of AARP in St. Louis, and she's the Associate Director for Outreach. Sheila, thank you for joining us. Gail McHenry, who's the Executive Director of Shepherd Center. Gail, thank you for joining us. And last but not least, Jamie Opsel. Did I say that right? Opsel, okay. It works. And she's the Senior Project Manager, I believe, at Seniors Count of Greater St. Louis. Thank you all, ladies, for joining us this evening. When I want to say that I volunteered to moderate this panel because aging in place is something that's near and dear to my heart. 4 years ago, when my husband and I moved to St. Louis from Cleveland, Ohio, while we were moving our stuff into our place, these high energetic two older ladies stopped by our house. And they wanted to know, they said, we want to know whether you have any walkers that are moving in with you. And we went, walkers? What does that mean exactly? And, they said, well, we're just, feisty old ladies, and we just want to know whether you have anyone who uses a walker. And I said, no, I don't think we do. But thank you for asking, and bid them adieu. So about 3 weeks later, driving into where we live, I noticed that there was a speed limit, and the speed limit was 10 miles an hour. And I thought, what is up with that, 10 miles an hour? And I said, come to think of it, we have very quiet neighbors. So several weeks later, we found out that we had actually moved to Florida, and the average age for people where we were living was actually about 72. So, we actually chose this place because it gave us an opportunity to downsize, and so it also gave us an opportunity to live in an area where we don't have to worry about climbing steps, because we both have, my husband and I have older parents. And when we started talking about our panel tonight, I said, you know what, just given my experience of moving here, and given the fact that I have older and aging parents, I know what it is when we talk about aging in place. And when I was 14, I asked my mom, I said, when you get older, what are you gonna do? Where are you guys gonna live? And she said, we're gonna move in with you. Yeah, we're gonna see about that. But the reality is, my dad turned 90 this year, my mom turned 86 this year, and for the life of my siblings and we cannot convince them to move in with us, because they want their independence. They want their social circle still with them. And it's a conversation that we're still trying to have. But while we're still trying to have this conversation, we're also making sure that, they have the community that can help with the needs that they have. And talk about technology, I communicate with my parents' doctor through WhatsApp. And they go visit, they'll send me photos, they'll say, here's the report. And I thought, that is really cool, and it's a new way of defining the fact that it really does take a village to ensure that our aging parents or relatives are doing well. So with that said, I'd like to pose this question to all our panelists today in terms of aging in place and what we know to be the increasing senior population in St. Louis. What do you think are the main issues with our senior adults in St. Louis? So we'll start with Jamie on that question.
Is it on? Okay.
Yeah, it is.
Okay. Well, I've had the pleasure of spending the last year and a half actually doing focus groups with older adults in the city of St. Louis County, and St. Charles County. And for them, just what you said, having the choice of living where you want to live, but with that comes the need to have supportive services in place. Examples of types of things that they often spoke of is being able to have someone come in and clean out my gutters or cut my grass, and I don't want it for free, but I want it affordable and someone I can trust. So having those types of services. Also, what's really like the number one issue that seems to come up is the issue of transportation. And having, again, choices so that they can get to where they need to go and have options. And not just for critical transportation, like getting to the doctor, but transportation so they can do social events as well. So many times, the programs and services that provide transportation have to basically limit what they can provide, and it really then keeps people very much homebound, and it impacts not only their it impacts their mental health as well as being able their physical health, because maybe they're not able to get to all of their doctor appointments that they need to get to. And I think lastly, for them, having resources in the community that provide models that help them get connected with services. Many times you don't know what you don't know, and I might not be needing this service today, but all of a sudden I'm diagnosed with diabetes and I need to know about resources for myself. And so being able to find out where you can get those resources without necessarily it all being on the internet. So those are some of the things that I've heard in the last year and a half from older adults in the community.
Thank you. And Lori is actually helping celebrate and remind us that this month is National Older American Month. And she is, you know, I know Lori, we go way back, and she tells me, Amy, you need to go to our website for Blazing the Trail, click on it, it'll take you, and I said, got it, I'll do that right afterwards. So Lori, what are you finding are the main issues?
In St. Louis County, we've spent the last 3 years talking to baby boomers and older adults across the county in focus groups and in surveys and in open houses. And in the county, it's really a quality of life issue where we think that quality life starts with where you live. And so the expectations of the services and programs that older adults receive in the communities that they live in is where it starts. So if you think about your housing options in your community, whether or not you can walk places, what kinds of transportation options you have, what kind of park and recreation and health and wellness programs, that they're really basic ways that people want to engage in their communities. I would reiterate with Jamie that just knowing what's available is something we hear about all the time. There's a lot out there, but how to access it is an issue. And I think in the county, we have a large population of baby boomers and older adults. They actually total over 400,000. We have more baby boomers and older adults than any county in the state of Missouri has people, except for Jackson County. So one issue that we hear about a lot is housing. People do want to age in community and in place, and the ability to take care of home repairs, to pay for utilities, housing support is very significant. As part of St. Louis County's initiative, we've produced a home care and repair seasonal checklist that we debuted. It's on our website. Sorry, it is on our website, but we printed it and debuted it at an older adult event a few weeks ago in Ferguson, and people were just gobbled them up and wanted to pass them out to their neighborhood associations and such. So we know that that's a need, and probably not enough services. So a lot of demand in that area and not enough services.
So Lori, I just want to ask a quick follow-up question. That you talked about service and you also talked about access. Are you finding that there are disparities in terms of the services based on what part of the county that you reside in?
We do know that there is disparity, and we have an interesting array of services that in some parts of the county we mapped all of the municipalities that provide transportation for seniors. And interestingly enough, there's about 10 of them, all in the North County area, and then there's just a few in the Richmond Heights, Clayton, Maplewood, Brentwood area, and then the rest of the county doesn't have any kind of a system like that. There are other, and I know some of our panelists will talk about some of those other kinds of systems. We also know that there is significant health disparity and economic disparity in the county as well, and it is concentrated in areas where the incomes are lower and it's harder to access. And there's actually, we mapped, and this is again on our website, sorry, we actually mapped the life expectancy for every zip code in St. Louis County, and there's actually a 35-year difference in the county between the lowest life expectancy in the community of Kinloch and the highest life expectancy in West County in Wildwood. So we do know, and that is part of our planning as we talk a little bit later in the program about how do we close that equity gap and that disparity gap. So thank you for asking.
Some of you may have heard of the For the Sake of All report by Dr. Jason Purnell, where he talks at length in terms of the racial disparity, especially when it comes to the longevity in terms of African Americans compared to Caucasians, and also compared to where you live in St. Louis. So there's actually more information about that report for those of you that might be interested at our website, but also at the For the Sake of All website. Sheila, what are the main issues?
So it doesn't pay to be third or last in this because we all have a common thread. So I will just echo a lot what Jamie and Lori have said already. Transportation is critical. For people to be able to get around is critical on so many levels, whether it's healthcare or socialization opportunities. That maintaining independence is a critical thing, not only for day-to-day life, but also just for mental well-being, you know, that I'm independent still. Having a good home to live in that's safe. That, you know, if it needs repairs, how am I going to get that done? How am I going to pay for that? Who's going to do that? And we have resources within the region, but not everybody knows about those resources. So that goes back to sharing the information, which Lori has talked a little bit, and Jamie did too, as far as making people aware of what resources are available and how to access those. Also going to the walkable communities. You know, so if transportation is an issue, how can they get around? And having those, you know, access to those resources will allow someone to age in place or in community, so that they can walk to the grocery store, they can walk to other services. But we need to have good sidewalks. We need to have services that are within that realm, you know, in that immediate area, and that there's affordable housing there. It's a domino effect. So. You know, we need one to help the other as we go through that. So I'll stop there.
Sheila, I'd actually like to ask you a follow-up question in terms of what programs do you think should be considered at the state level, whether it be for Missouri or Illinois?
Well, so one of the things, and I think that this touches on the aging in place, but also the support mechanisms for that. And it's something that actually we've put up to vote in the legislature right now. It's called the CARE Act. And so it is a bill that will require when someone you're caregiving for goes into the hospital or to an emergency care unit, and many times they'll just release them. And you won't know as a caregiver, are there, you know, specific things that need to be done with that for that individual to be trained on the administration of that. Maybe they move them to another facility and you don't know that. So this CARE Act will put that into place. And so I think that is something that helps also for that independence of that individual, but also the support network for them. I think another thing, and this may not seem like that fits with that, but voter ID requirements. You know, so we got to maintain our independence. If I don't have a driver's license that is current with this voter ID legislation that they're playing around with right now, is that, well, then I can't vote unless I get, you know, an ID. Well, maybe that's a bit of a challenge for me because I can't drive, obviously. I don't have a driver's license, you know, and so on. So I think it's, you know, on the state level, whether it's in Illinois or in Missouri, both states are working on both of those kinds of, you know, many of those things. Nurse practitioners being able to provide the services, especially for our rural areas where, as Mary had pointed out, it has the fastest growing older adult population. Being able to provide those medical services to them is critical. And so what is it that we need? You know, a lot of us, we don't even know that that's an issue because we don't live there. But it really takes all of us to be aware of that and to help push those types of programs and that legislation forward. So those are three quick ones.
That's a good start. Thank you.
Well, I agree. When you're at the end of the line, two things I was going to focus on, of course, were transportation and then being able to keep your house safe and repaired while you're home. I mean, we all know those are two main issues. We're the Shepherd Center of Webster Kirkwood, and I've been there 16 years, and about 10 years ago, there was a boom. So there have been 8 to 10 different senior living communities pop up in those 2 communities. 2008 kind of hit a lull, and a few didn't get developed. And that really changed what we do, because many of our friends that are that greatest generation moved, and they didn't really need us for the social part of it. They continued to need us for their transportation. If you can imagine, you're living in a senior living community, you don't get to the doctor. So we continued to do that. What we then did is we decided, what do the boomers want? What's in line with them? So we, again, did some focus groups. And the 2 main things are, I want to be in my house, I want to be able to get where I want to go, when I want to go. So those are the main issues. They also had a few other things to say. They want to stay engaged in other generations. They don't want to be removed and isolated. And we all know that families are different now than they were when we grew up. People stayed in town. Many of our friends have, 4 and 5 children. None of them are in town. And so when they hit those critical points in their lives and they want to stay in their community, who helps them? There's lots of options out there, but they really need personal, relevant, and connected people to help them get through this. I see it.
So Lori, this next question will start with you in terms of how would you characterize the role of the government, especially when it comes to aging in place or offering services for older adults?
Well, I think it's appropriate that May is Older Americans Month, and that is sponsored by the Federal Administration on Aging. And I would say that, and the theme is Blaze a Trail. And so I really appreciate that, because I feel as if our county and our county executive has really helped us blaze a trail with regard to becoming being an age-friendly community. So after the 2010 census, we were really struck by the numbers that Mary shared with you, and then of course because St. Louis County is so large, the largest county in Missouri, the scale of that issue is so significant. And we've begun thinking about what is our role, what are the implications for our community and for us as a policymaker, a deliverer of services and programs to the community. And we began looking at the very issues we're talking about. We wrote a policy brief back in 2012. Well, what does this mean for housing? What does this mean for transportation, for how we share information with our constituents? And we were looking for a framework to really focus this issue, to put not only the county, but our municipal leaders as well, to think about and be prepared intentionally about this aging population. And so we applied to AARP and the World Health Organization to become what's known as an age-friendly community. And you have to put an application together and be selected, and it's a 5-year commitment, 2 years of planning and assessment, and a 3-year action plan where you commit to implementing a plan to address these issues. And the 4 kind of big issues are around mobility, around housing and safe neighborhoods, around health and well-being, and around social and civic engagement. And so we feel, again, we want our community to be a community for a lifetime, and we believe that the quality of life in the county is so intricately tied to our neighborhoods and our hometown communities that we have put forth this plan for our entire county. And so we feel we are the first and only community in Missouri to be an age-friendly community. We are, with a 1 million population, we're one of the larger in the country, and we work very hard to put this on the public agenda, to say these are numbers too big to ignore,
And we need to pay attention, we need to be prepared, and we look at it through what we call our age-friendly lens. And let's think about everything from when you come to a county facility or a municipal facility, how age-friendly is it, how inclusive, how accessible, how readable, how understandable are the services and the programs that we offer. So we think government has a very significant role. Obviously not the only role. We have great partners with not-for-profits and the business community, and we have some great relationships maybe I can talk about later with some of our fine universities. We're doing some really wonderful work with our university partners. But yes, government has a big role because we're the ones, your streets, your sidewalks, your housing inspection, your voting experience, we are the ones who are delivering those services.
So a follow-up question to that is, if you're helping create this notion in this community of an age-friendly community, what can the rest of us do to ensure that this is successful and also accessible to all?
Yeah, one thing that when I've spoken to groups around the community and business groups as well is to make sure that there's an age-friendly agenda in your community. Ask and be vocal and be engaged in what your community is doing around these issues. One of the things that we put together in our municipal toolkit, and one of the things we included was a bank of survey questions. We have a number of our communities, Chesterfield, Creve Coeur, Clayton, Maryland Heights, big communities who routinely do citizen surveys, and yet many of them don't explicitly ask about the needs of an aging population. So we've also put in our toolkit how to promote establishing an older adult commission so that there is an intentional established voice in your community to make sure that those policy issues and those needs are being met. Those are just a couple of examples.
So are there any best practices? I know we're kind of the first in that nationally that we can take a look at that serve as a model.
Well, one that has gotten the attention from, let's see, Toronto community, and then recently Agefriendly Sarasota. Is that right? I'm looking at my staff, Amy Humboldt, who does a lot of the great work for our Agefriendly initiative. We put together, we literally looked around the world through the World Health Organization, around the world for a way to assess how age-friendly are our community facilities. So our city halls, our parks and recreation community centers, our government facilities in Clayton. And not just are they ADA accessible, although that's important, but are they age-friendly? What's the signage like? What's the parking like? How easy is it to deal with the customer service? But it's a very detailed audit that we would like for students or community members in any of the municipalities to say, hey, we could actually audit, assess our community facilities for the benefit of all of our residents.
Thank you. Jamie, what would you say are some additional policies that should be considered?
Well, in looking at that question, I look at what other states have done. And for example, in California, Florida, Washington, they work at getting planners, transportation planners and land use, local community planners working together so that they're developing the land so that it has a transportation avenue for people so they don't have to go more than a few miles to get to some sort of hub so they can get transportation, which also includes not just the transportation, but the affordable housing, the walkable communities, and the community retail outlets so that you don't have to go to a mall 4 or 5 miles or 6 miles down the road, but it's more of a local getting back to how we used to have it, more local communities. Another policy that I found to be extremely important, especially in the days when I used to work at the Area Agency on Aging at Mideast, was joint use. Being able to utilize schools, especially in areas where it is a naturally occurring retirement community where there's a lot of seniors, and the schools just sit there and sometimes they're abandoned. But they're still accessible. They still have resources there. They have gymnasiums, they can have libraries, they have art rooms and so forth, they have kitchens. When I was working at Mideast, we were trying to find senior centers, especially in areas where there were low income areas. And as a federally funded and state funded program, we couldn't do it alone, and we were looking for community partners. And it was very hard to find community partners. But if we could use those schools, and we wouldn't even have to use the schools, pretty much schools go used during the school year and then they sit vacant during the summer. So if programs and services were flexible, if instead of having a noon meal for a senior center, what about an evening meal? What about using the kitchens there to produce the meal instead of having to have frozen meals brought in? What about, and by having the older adult involved back in their community, in their school, where their own kids went, they get to stay in that community. So I really felt like that was a really good idea of utilizing resources that we already have here.
Gail, thoughts about that?
Well, I like all those ideas. And, if I could have one wish, it would be that each community in the St. Louis area and Jefferson County, which is where I live, would have transportation, a bus. You mentioned there are quite a few good resources in North County. There are, Maplewood, Richmond Heights, Brentwood has it, and I think that's thanks to East-West Gateway Council of Governments. But I think it's necessary, and that does make it so much easier for seniors to get around. Today we were out and about. We went to the City Museum, we went to the boathouse, we had a fun day, and I'm kind of exhausted, but it was a lot of fun. And all the kids are on field trips. There are so many buses out there for kids. Well, what about the seniors? Just one bus for the community. That was my light bulb today. Let's get a bus for every community.
Good point. Sheila?
One of the things that any community of any size can do is a very simple thing called complete streets. That the county passed when we have several communities in the St. Louis region that have it passed. And that's really about making sure that our streets, our sidewalks are accessible for all users. Whether you're on a bike, you're on your foot, on foot, if you're driving, if it's mass transit. So it's making it accessible for all. And that is something that, again, each community can do and put in place and engage the community in it as well. And we've worked with Lori on the county one. We just recently did it with Florissant. There are several communities that already have it, and we have those best practices in place, but we need to tell each other about them too. And there's something that the city of St. Louis did last year that was phenomenal, of hiring a bike ped coordinator. And that's a huge move, and that's when you started seeing the bikes on the road. So, so that's one thing that can be done that is not, it doesn't matter what size your community is, but can have a huge impact in your community.
Yes, Laura.
That just made me think about in our typical, usual St. Louis style, we don't always work as well collaboratively and cooperatively as perhaps we could or should. And so I think one really important thing is really looking more at consortiums and collaborations and places in the county that it's interesting, and this isn't to be disrespectful or dismissive of any individual community, but when we mapped the 8 different communities that have buses, we had to create a matrix to actually understand, who went where and who was allowed to cross over a border. And there's there's probably more money that is spent because we do everything individually and don't look at, look at these collective, collaborative efforts. One of the reasons we wanted to be in the AARP WHO network is to be a model, to create models and templates, to learn and share from each other so we don't have to keep on reinventing the wheel. I will put a shout out to a group of communities who are going to be meeting next week to talk about transportation options in the Mid-County area to say, hey, let's look at this collectively. We've also encouraged municipalities. There are very few municipalities in St. Louis County who have full-time staff devoted to senior services. I was shocked to learn that the most common purveyor of senior services in our communities in St. Louis County are parks and recreation departments. So there are only 2 or 3 communities that have full-time senior type service coordinators. We've encouraged for smaller communities to share perhaps a person or a staff among multiple jurisdictions, and we just need to think more, we need to think bigger and more cooperatively.
And I think between counties and cities, regionally, we just don't do that well, and so it is unfortunate, but because no one wins, then let's share.
You have a point you want to add?
Sorry. But for some reason, I'm off. But I also want to reiterate what Mary had talked about in the very beginning. Right now, currently, the resources that we have aren't even able to meet the needs that we have currently of the number of elderly that we have in our community. What happens in 14 short years when the end of the baby boomers start entering? We don't have enough resources. And these are all great examples of things that communities can do to think outside the box and try to plug the gaps and so forth, but we're really not staying ahead of this huge tsunami. So we need to be thinking about these creative ideas, but we need to be looking at funding. Where are these resources? How is it going to be paid for? Where is this going to come from? And it's going to take all of us. It's going to take national, federal resources, state resources, and local resources to be able to make this community a livable community for older adults to be able to age in place.
So where does the current funding come from? Anyone know? Where could we look?
Well, I know right now the Older Americans Act through the Area Agencies on Aging provide resources in the community for people to be able to have those home and community-based services. But I also know that the funding for that has been decreasing in the last several decades. As the number of people have grown, the funding has actually decreased by 34% since 1980. That's one resource. Then you have these local resources, these different municipalities, these little governments that have their resources, but as Lori said, everybody kind of keeps it to themselves. An example is the Alzheimer's Association. In the state of Missouri, we have 110,000 people who've been diagnosed with one type of dementia. Right now, the Alzheimer's Association gets about $500,000 a year from the state government to provide respite care services. So that equates to about $5 per person. They can't even advertise that they have this resource because by the time they get it, within the month, it's completely gone. But we know that these numbers are increasing. It's not going to stay the same, it's increasing. So we need to think of outside the box, but we need additional resources to be able to meet the needs of the aging population.
I also think that we need to think differently about how we provide services in the future and to think in a less siloed way about senior services. I think the baby boomers continue to put their mark on each stage of their life development, and there's some interesting trends right now where you would think as the population ages that volunteerism would perhaps increase. People have more, opportunity and time. But actually, in some cases, volunteerism is decreasing because the baby boomers have very different expectations. The notion of a traditional senior center is probably something that is going to be probably not work as well. I think back to a point that was made earlier about intergenerational. I think the notion of collecting more community resources that not only serves seniors but that serves other community needs is an emerging model. I don't know if folks are familiar with the Covenant House or the Crown Center in University City, Covenant House in the naturally occurring retirement community area of the Creve Coeur area, where they're looking at much more integrated models. So there are going to be increasing needs. I also think that we need to sort of look at how we allocate those community resources differently in the future as well.
I'd like to pause for a couple of minutes and see whether there are members of our audience who have questions of our panelists before I continue.
The issue of home safety has been on my mind a lot lately. In just the last month, I think 3 different people I know, older people, have had to call 911 because they've fallen and can't get up. And a fireman who lives down the street from me tells me there are days when all he does is drive around and pick people up. It's really making me struggle with the question of, is aging in place always the right answer, or when is it the right answer? And what are the options? What options are out there when somebody needs round-the-care assistance?
Well, if you can afford it, you can get round the clock care. It usually runs anywhere between $60,000 and $80,000 a year, and most people, even when they save, can't save that amount of money. But Missouri is actually one state that we have a 30% higher rate of falls on seniors than the national average. And I was asking Dr. Susan Stark at WashU, who oversees an occupational therapy program that does in-home assessments, why is that? And we're really not sure, but we do know there's things that can be done to go in and assess a person's home to keep them from falling. There's great programs out there. But again, we need to invest in prevention, but what we tend to do is we wait till after it happens and then we pay the big bill. We haven't gotten smarter here. Back in the day, we used to have programs and services where we had a person to be able to go in and do these things, but over the years, those programs and services have been cut. The focus tends to be on youth, and especially in the area of prevention. And that's just simply due, somebody asked me, well, why is it? It's just simply due to ageism. It's the honest truth.
Just a couple comments. In St. Louis County, we have a very high share, similar to the numbers that Mary has in her report, but 82% of our 65 and older adults in the county are homeowners, but they own homes that 2/3 of those homes were built before 1970, and so we know that the issue of retrofitting, creating universal design-like features in homes would be something that would help address. Our plan actually looks at potential partnerships with the Home Builders Association. There's actually a aging in place certification process. Again, it would take resources and partnerships to do a better job of addressing home retrofitting. That is one issue. We also know that a large share of senior households are single people, And I think 45% of over 65 households in St. Louis County are single individuals, and of those, 75% are women. And you start thinking about, what are the appropriate or desired or preferred living arrangements, perhaps. And there's actually a website called goldengirls.com where the concept of, particularly for women who want to live together, is something that in other parts of the country is popular. And when you look at some of our zoning regulations and occupancy, even things like that can be impediments as we look to what are these options in the future. So we definitely need better housing solutions.
So we've talked a lot about homeowners. Just a quick follow-up to this. Where do renters surface in this demographic that we're talking about?
I'll just say that in the county, in looking at who our most vulnerable seniors are, the most vulnerable seniors in St. Louis County are renters, are women, single women, and African American households. So yes, renters are definitely more vulnerable.
Go ahead.
I should just stop turning this on mute. There's actually a really wonderful new program that Lutheran Senior Services just started with their with low-income housing, not just their own, but other low-income housing for seniors, with the Parish Nurse program, where they actually have kiosks in these low-income apartments that will do blood pressure, blood sugar, different types of assessments, and then the parish nurse will come once a week and be able to read these, provide information back to people about what their readings mean and provide follow-up and supportive services. And they've diagnosed a lot of people that had no idea that they were diabetic or hypertensive and so forth. And that's where the parish nurse program is a great model that we have here in the region. Again, it needs funding to be able to expand, but when you get several different churches pulling together their resources to be able to hire a full-time nurse that's in the community, the people then begin to be able to trust this person, ask questions, and stay ahead of their issues versus finding out later when they're completely out of sorts and they're really, really sick and it's more expensive to take care of. Again, focusing on prevention is really key, and it's something that we need to start doing. And not only just start doing, but start doing now. I've been in the field of gerontology for over 30 years, started when I was 5, and I'm telling you, they kept saying, it's coming, it's coming. We keep telling people it's coming. Well, it's not coming, it's here, and we need to act.
But I think, I'll echo what Lori said as far as changing the model and how we approach the aging population. Being a boomer myself, I don't fit in that same mold that my parents do that live in Sun City West in Arizona. It's different, and we have to think differently, and we have to approach this, through a different lens, but also then including people in that discussion. And not trying to make decisions for people. So I think that, all of us do focus groups and need to continue to do that, to engage people in the process, because you cannot tell, especially a boomer, how they're supposed to act and how they're supposed to look and how you're supposed to feel is not going to float. It doesn't float.
Okay, we have questions.
Hi, I'm Eric Lentz. I'm actually a researcher at Washington University in exercise in older adults. I have a question about exercise, and if you don't mind, I just want to preface it with a comment, as my wife calls it, mansplaining. I don't know what that is. But, so if there would be one way to improve the physical and mental health and reduce the disability of older adults in St. Louis or otherwise, it would probably be to get them to exercise and exercise regularly. My patients, who I see most, and I'm a geriatric psychiatrist, most are quite sedentary and actually unaware of unaware that exercise is really best for older adults, and really unaware of the possibilities for getting exercise. And this doesn't seem like the most exercise-friendly city, like compared to when I visit San Francisco or South, where everyone looks like they just walked out of a gym. Are there efforts to try to transform St. Louis into more of an exercise-friendly area, particularly for older adults?
I can start on this one. So one of my main goals or target areas in St. Louis with ARP, our theme is healthy, active living. Everything we do has that kind of spin on it. So whether it is, we're a sponsor of the Moonlight Ramble. So you think, oh, wait a minute, why are you doing that? The largest percentage of riders in Moonlight Ramble are 45 plus. I mean, so it's not like, so we don't move. So we do guided bike rides. I mean, I think it's, setting up some of that more structured opportunities, offering it to them, and keep communicating it out, and then showing up those role models. We're a sponsor of the St. Louis Senior Olympics. We have Team ARP athletes. Our oldest one is 92 and our youngest is 50. And so I think it's, again, creating those opportunities, keeping them engaged, and showing up those role models too, that anybody can do it. And I know that sounds very simplistic, but I think it's just beating that drum over and over and over.
I would agree, and I think St. Louis has lots of options in terms of programming. You can go to the YMCA's. Wayne and I were just talking about the silver sneakers. That's just all the new rage. The community centers, which Jamie spoke about, city governments, often the senior person is in the recreation department, and they're developing programming. At the Shepherd Center, we've got yoga, tai chi, slide dance. Whatever they want, we offer it. It's not the country western line dance of the days past, it's slide dance. So we're responding to what people want and need. And I think in all of this conversation, we always have to consider keeping the seniors, older than us, although I'm here because I'm a senior, involved in the conversation, because they have opinions, they know what they want, and that's what you want to offer. You're not going to make them do what you think they want to do. And so I think if you look, you'll see it. The libraries have yoga out in Jefferson County. They have yoga in the library, yes. I'll be there next month. So there are options, and maybe you're seeing a little bit different crowd. We do some intergenerational things, and one of them is the senior prom. And the two queens were 103 and 105. And how did they get there? They are the rhinestone cowgirls. And then we had the 3-year-olds, but I think it's there if you're inclined to do it. And I think St. Louis is getting better about that, actually.
In St. Louis County, we're all about pickleball. So in our Agefriendly plan, we actually inventoried all of the community recreation centers and community centers and all the libraries in St. Louis County. And it is amazing how much goes on. I was particularly struck by the county library system. We actually had them do a survey of what was offered in the libraries, and it was really quite impressive. But I'd also like to mention that since you're affiliated with Washington University, to put a shout out to a really special experience that we just completed with the occupational therapy graduate students at Washington University, who actually did a project for us looking at health and wellness programming at community and recreation centers, in the neighborhoods, and what incents or prevents seniors from participating in them. The particular so it was a group of graduate students working through a course this semester. We had one group working with our Parks Department in South County, and then the other with our Public Health Department in University City. And these students literally went to barber shops, hair salons, bus stops, anywhere that they could meet and talk and find folks, because you don't want to just talk to the folks who are at the community center or in the programming, because those folks, get it. So they put together a proposal for us to actually build a coalition of providers and churches and community groups to actually try to figure out how to reach and engage hard to reach and engage older adults in health and wellness type programming. And we're excited, I'm looking at Amy because she's very involved in it, to actually pilot it and implement it sooner than later in St. Louis County, probably in the near north or north county area. So it was a great experience, and we're really have appreciated that partnership. And literally, this was a professor who had been involved in our Agefriendly planning process who approached us, and they selected recommendations out of our plan that they thought would make great projects for their students. So we're hoping that we'll better understand those issues. One thing that was interesting when they surveyed the adults who were participating in programs, said, what's the number one reason that you participate in yoga or pickleball or whatever? And it was actually the social aspect of it. So I think that's an important piece of knowing what they're looking for and why they're there. It's not necessarily just the activity itself.
And I was just going to say, when you mention like these other cities, especially in the East and West Coast where you see people more out and active, I think it's because they put policies in place and they have those walkable communities. In Missouri, we're just a little bit behind. We have to be, show me how it works. And then the other aspect is, I was formerly with the St. Louis County Department of Health for 18 years, and when you live in a community where you can't afford a community center, you have these options. But if you live in a community that can't afford it, you don't have quite as many options. So again, it goes back to what you had asked before about disparity. And I think that's why you see the difference in life expectancy rates based upon zip code.
I would also add that if you've had a chance to visit the Jackie Joyner Kersey Foundation in East St. Louis, Illinois, the community center there actually has a program for children, but it also has a program for senior citizens. And whenever I've had an opportunity to take a group out there, they always wonder, why is it that I bring people over there about 11 a.m. And that's because there's a group of ladies, I love 70s music, and they have an aerobics class, dance class, and they're always playing 70s music. So they always invite us to join them. And I tell you, those ladies do kick some A.
Yes, we have a question here.
So I can speak pretty loud. In education, for North County, you have somebody like Tiffany Anderson, who did a great job in Jennings, didn't say I need more money. She found ways to do things. Is there anybody in the area that you're talking about who's a model, as Tiffany was to education, that they are to seniors? Does that make sense? Anyway, Tiffany was one who, in order to get parents to come to school, put washers and dryers in schools so that the parents could do their wash when they came in to volunteer time or to have a conference. This is really creative thinking, which really didn't cost a lot of money, but people thought about. These are the kinds of things, in some ways, the community's going to have to do.
Yeah. I think there's some community leaders that are dabbling around it, but not seeing some amazing results yet. They're trying, but I think it many times then revolves around the money, aspect. So maybe not in the same fashion that you're illustrating there. But one of the things that Lori had talked about was multiple communities getting together and trying to share resources and work on that, like the Central Corridor. So Maplewood, Brentwood, Richmond Heights, Clayton area, are working together, and it is a couple people that are trying to pull it together, but I don't think it's in the same vein as far as that grassroots approach.
I think as far as some of our communities in St. Louis County, one of the municipal leaders is the city of Florissant, who really do quite a bit for seniors. They have a really easy to navigate information page on their website. They have 2 community centers. They do, they have full-time staff, but they do really nice things, like they have their golden age pass, where they have a big partnership with the businesses in their community. So they really work closely to make sure that seniors get discounts and know which businesses are age-friendly businesses, if you will, which is an initiative we would love to see in St. Louis County. It's part of our plan to eventually get to a place where we can do some things like that. But they do a lot of things right there. I know that the city of Richmond Heights also really made an effort to dive into this Richmond Heights and Maplewood, both, where they identified every resident. Now these are smaller communities, but they identified literally. I saw a dot map every neighborhood where all their older adults lived. They partnered with Walgreens to offer benefit cards as an incentive for them to come and participate in focus groups and activities. They provided transportation so that they would participate. So I think there are I'm sure there are many around the community. Those are a couple from my perspective at that municipal level where some things are happening.
I would also quickly add that in terms of national best practices, cities that have aging improvement districts is New York City, East Harlem, Oregon, and also Philadelphia. So it's not so much an individual as it is either through the districts or through nonprofits that are really advancing change in those arenas.
Yeah, if you want to, New York City is just phenomenal with their age-friendly work, and they have an amazing business plan, like Lori was just indicating that we want to try and get together in St. Louis County. New York City is phenomenal with their age-friendly stuff, as well as, of course, Portland is one of the leaders. And we do have a naturally occurring retirement community here in St. Louis region that is fantastic. And it's in the Creve Coeur area. It was one of the models 10 years ago, national models, and hardly anybody knows about it unless you're in the aging, industry. So, but very cool.
We have a village too. We have
village.
we have the new St. Louis Village. Again, that's you join, you're a member of the village. In the NORC, it's a very naturally occurring retirement community. More than 35% of your population is over 65. There's a small fee in the NORC, but there are a number of benefits and home repair services and volunteer services and activities. And I think, I don't know the timing of it, but I think when the new Covenant House project is completed, they're going to have a community center that's going to be part of that project to have a much more integrated approach to intergenerational and intercommunity approach for that. So I think that's kind of like a leading model, I think, coming to the St. Louis area.
I think I saw a hand.
I think we have a model here in St. Louis with the Shepherd House,
Exactly.
Shepherd Center, because it's a consortium of churches. It's a variety of activities and services for seniors. It has transportation. It has breakfast on Friday with 3 or 4 different lectures, learning classes. It's got exercise classes. And if different communities could get 5 or 6 churches together and say, we're going to get a transportation service volunteer system going, and we've got the church's community center that we can use. You know, we could do that throughout all of St. Louis, not just in Webster, Kirkwood. And it's been successful for 16 years, so take a look at it and say, how can we incorporate? We had someone come to our activity today from U City. Why can't we get the churches in U City to do the same sort of thing? Why can't we get them in North County? So it's, you know, it's there, and I think people want to and are looking for places to volunteer. Shepherd Center could be a model for that.
And then you build upon that. You don't just have the churches, but then you have the local government. You have the federal and state funding through the area agencies on aging. You have all these different resources being pulled together, so we're not siloing our, you know, our different programs and services. They're actually coordinating the services together. So, and then no one organization or entity has to pay the full bill.
Yes, thank you. I am a caregiver, and I refer other caregivers to homes. I was sorry that the study didn't include any references to caregivers, not just the professionals, but perhaps more importantly, the family members, the spouses and the kids. Just this last week, we saw the legislature override Nixon's attempt to increase the minimum wage for caregivers. And in Missouri, there is no way to achieve a certification in home health assistance. The lowest certification you can get is CNA. And the CNA is basically overqualified for care in the home. There's a variety of different approaches. It occurs to me that there might even be, well, it's an issue that needs to be looked at closely if it isn't already. And I wonder if your panel can address the needs to improve the quality of care in our community, our state.
I can't speak to the paid caregiver, more, you know, what, I mean, we do some with that on ARP on a national and on a state level as far as the advocacy work. But we have been really focusing on the family caregiver, and one of the things that we've really been pushing for are for businesses to provide time off with pay for caregivers. You know, we give time off with pay, well, some places do, for people to have children, but what about taking care of our parents or our loved ones? And, you know, and that's something that then, you know, shows the value of what a family caregiver contributes to the community, also to their, you know, loved ones, so that they can stay independent a little longer, at least not in subsidized or funded care. I think that it is raising that awareness of what caregiving is, and I don't think people really, you know, they don't know what's entailed with it, and I think that that is a problem. One of the things when we were trying to get the Care Act pushed through, I mean, why wouldn't you want to do that, you know, first off? So, in the state of Missouri, and I think it's education, you know, it's just beating that drum and educating people about what is caregiving, you know, and you're going to be there, you know, you're going to be there. We're all going to be there if we're not there yet. So, Rosalind Carter had a great saying about caregivers, that, you know, you're either being cared for, you are a caregiver, or you're going to be a caregiver. So, I mean, that's everybody. So.
Most of the caregiving that's going on, the families are doing. I think 87% of all care is being taken care of by the families themselves. And again, they need resources in the community so that they can continue to work, take care of their own kids, take care of their aging parents as well. And that's why our initiative, Seniors Count, is really looking at how can we provide more resources in the community for the families, not to take the place of the families, but to help support the families so they can keep it all together. And that's what Jesse Bogan from the Post did a wonderful story a few weeks ago about a family member who was trying to figure out how to care for their aging father. And they couldn't afford the cost of a professional caregiver, and so they kind of, try to be creative with it. And what's really interesting is that as a result of that story, he happened to just interview me, and the people that called him and said, "Can you help me find resources?" And then he started referring them to me. And so I forward those to the Area Agency on Aging so that because they have geriatric case managers that can help assist families. But again, families need to know about resources, but at some point, the resources are dried up, and families need that support.
Okay, we have 2 more questions, and then we'll take final comments from our panelists.
Hi, I have a question. I'm a health education specialist, and I study midlife women and social engagement. And I wanted to know if you could talk a little bit about maybe cities that have a model for that social engagement with dual-use buildings, similar to what you were talking about. But what's going on elsewhere that we might be able to emulate?
Yeah, I know that there's a huge co-housing, which is what Lori was referencing earlier. I'm trying to remember where they are. I think there are some out West Coast, but I don't know for sure. But if you give me your information, I can send it to you. I know that ARP has done, a lot of research as far as with livable communities and that co-housing being a perfect model to meet those needs of being independent and being able to have that social interaction, and not and still feel like they have their own home, more or less. So, but a specific community, I'm sorry, I'm at a loss on that.
The sharing of the resources does happen in St. Louis, not necessarily in the cohabitation, but Jamie was talking about Mid-East Area Agency on Aging out in Jefferson County and House Springs. In one of the school buildings is the new site, and next to it is the child care center. And so it's intergenerational, it's using a facility that was vacant because they didn't need it at that time. So that does happen. Where the Shepherd Center is, we're in a congregational building that has a gym, so we're sharing. We don't own that building, but we're cohabitating there with our activity. So it does happen on a smaller scale around here. I know you were asking for other communities, but that does happen.
California and Wyoming are 2 states that use the joint use, where they use schools to host senior programming throughout the year, especially in communities where it's the schools are vacant, but other communities use schools that aren't vacant and just accommodate the timing differently to host children during the day and then older adults in the evening.
Hi, my name is Juliet and I work for Oasis, and I just wanted to address a few things about some of the community projects and some of the other multi-use spaces, because we do all of those things, working with Missy Stacy from St. Louis County. We have exercise programs in Jefferson County libraries, working with them, and also St. Louis County. But one of the projects that we've really been trying to work on too is that sustainability of the community health education and prevention. And one of the biggest, my biggest task in the next year and a half is to try to get insurance companies to start paying for prevention. And when you look at those graphs and it's just going whoop, we have to think of something better. And I really hope that I can convince the insurance companies and Medicare Advantage plans that it's going to have a bigger return on investment for them to start paying for these evidence-based programs that organizations like Oasis does put on in the community. And so I put an ask out there to all of you in the medical community as well to start thinking about how to better integrate community health into the medical system, because we are going to have a stronger partnership moving forward to keep people healthy and where they want to be in the homes.
So I'd like to reply to that. We have been United Healthcare through their At Your Best program, which is a pilot for Medicare supplemental clients that they have. And that is doing that exact thing. And so they're piloting it in Missouri and New Jersey. And so I think that they're on the track. So I encourage you to hit United up because that's in their wheelhouse. They're really seeing the advantage of that. And in fact, even though it's an ARP product, I can't talk to them. But they're promoting ARP things that are healthy, active living activities to their At Your Best clients. So I would definitely check out United Healthcare on that. So I think they are primed. I think they're realizing that they need to do that as well.
All right, please join me in thanking Gail, certainly Jamie, Lori, and Sheila for joining us here tonight. I think one of the things that we've learned is that the work is just beginning, and especially for those of us who in a couple of years will want to age in place, there's some things that we need to start doing now and learning from the best practices nationwide and also globally. So join me please in thanking our panelists. I also want to take this time to thank the library for hosting us and allowing us to do this event here, and also our partners at East West Gateway. I want to say this will continue when the next publication comes out. Have a great evening, everyone.